Hi, my name's Shannon. Excuse my hair. I don't usually look like this. And this is not how I wanted to start my videos. But I wanted to start a vlog of kind of what I go through every day and a little bit about my medical history, what I'm suffering with, how many medications I'm on, and I still don't have any relief. I literally just got off the phone with my neurologist. That is why I look like I've been crying, because this was really hard for me. So, long story short, I guess. Sorry. I'm a clinical mental health student. I'm going to school for counseling. I really enjoy what I'm doing. I'm thankful that I have what I have going on. But my mental health myself is wearing thin. I am in the middle of getting help for that. I am seeking help. However, my health condition has really made it hard for me to live every day. And that's really hard to say because I've worked very hard to be where I am. I used to weigh almost 400 pounds, and I've lost 186 now. I had gastric sleeve surgery, which I'm ever grateful for, because it's helped me a lot. I have struggled for many, many years, which has now finally got a label of lupus, rheumatoid arthritis, Sjögren's, and Raynaud's. Recently, over the last year and a half, I have been diagnosed with positive ANA, and I'm receiving treatment for that. But something worse has come about that affects me. I don't even know how to describe the pain that I go through every day. But I have trigeminal neuralgia, or trigeminal neuralgia, however you say it. I don't even care. Hopefully somebody knows what I'm talking about. It's face pain. Now, I have severe nerve damage to the right side of my body, unknown cause, but in the last year and a half, I have had on the right side of my face, it goes directly down and to the right, severe burning pain. How it started was my lips just went numb. And I talked to the neurologist. Well, I talked to my pain doctor and told him, and long story short, although I got two neurologists, one in Dallas, one in Fort Worth, and a neurosurgeon on board, and just a whole medical team that I'm kind of thankful for that I'm seeing now. But I'm still in a great deal of pain every day. And I'm on all these medications. I have them sitting here next to me. I'll go through them in a minute. So I have this trigeminal neuralgia. It started with burning on the lips, or numbness on the lips, and then it started with the burning. and numbness inside of my mouth and on my tongue. And that was a couple months, I think maybe 6-7 months. And then it started to radiate into here. And it felt like somebody was punching me in the face nonstop. And it would come and go. It wasn't always really the same time of the day. God, I'm looking at how crazy my hair looks. I probably look like a lunatic. I'm sorry. I don't ever look like this. And it started getting more consistent every day. I could almost set a watch by it. About 10:30 in the morning, it would start with the numbness, and it would creep. And by the end of the day, I mean, it felt like somebody had hit me with a freaking frying pan that was still hot. And it seems like every day the pain is getting worse by the minute. I don't know what to do, where to go. Right now, I'm seeing, as I said, 2 neurologists, one at UT Southwestern and then one in Fort Worth here at Clinical Neuroscience. And they're both good doctors. They are doing their best to help me. But I just feel, I don't know what I feel. I feel like I need to get this out. I need to get this heard. If there's somebody else out there that's dealing with this, I'm so sorry. There needs to be more study, more research on this terrible disease that is so crippling. I don't know. So I wanted to make this video, I guess, just kind of explain what I go through every day. My intentions were, I've been thinking about this for about a month to do the videos, and I kept putting it off because I don't know. I don't want to be one of those people that's like, oh, poor me, because I'm really not that kind of person. But when you're dealing with pain, you become that person because you don't know how to be anything else, because it's all you think about, because it's all you feel every day. So my intentions was to start these videos out with my hair done, my makeup done, tell you a bit about myself and my history and yada yada yada. But this is real. This is what I'm going through, not the pretty Shannon that everybody sees on Facebook. I mean, not to toot my own horn, I know I'm a pretty person. I know I can do makeup and look nice and get dressed up for work, but this is me. This is what I deal with, and this is not what I want to be. I want to be that pretty person that goes to work and is happy and everything's wonderful. I don't know. What does that look like? I've been dealing with pain for most of my life. I've been told, oh, you're a hypochondriac. Oh, you're a pain pill seeker. You're fat. You got mental problems. You're depressed. You've got anxiety. You've got this. You've got that. Sorry, it's my phone. I've been told all these things. And it's caused the depression. It's cause PTSD. I've been told a lot of things by a lot of professionals that has really brought me to the conclusion that I need to follow through and get my doctorate if I can get this pain under control, and do a thesis on PTSD and depression that is caused and created by professionals, clinical professionals who are supposed to be helping. I'm thankful I have who I have now. My rheumatologist, my 2 neurologists, my neurosurgeon. They all hear me. I know they hear me, and I know they're listening. I know they know that they're doing the best they can, and it's just going to take time to find a cure or to make it better or whatever. But I feel like I finally have a good team of many years of being told that it was my fault. It was me. Especially when it comes to you're too fat. Now, I've had 2 surgeries. 2 freaking surgeries. I've had the gastric sleeve, and then a year later I had to have a gastric bypass switch because I had GERD so bad that I couldn't sleep because I was choking in the middle of the night. And it just seems like my body fights so hard against me, and I fight so hard, and I hate to be like that, but I'm getting weary. I'm getting tired. It's hard. And to always put on a face like nothing's wrong. I don't think a lot of people know, honestly, the tears I cry every day. So anyway, I guess I was just kind of here to explain what's going on with me. Try and start, I guess, a YouTube. I don't know. Vlogging. I guess I'm old. I'm 42. I'm gonna be 43. So I don't know much about all this crap, but hey, why not, right? I mean, maybe somebody out there is dealing with the same thing and has some answers or something that works. I don't know. So I guess let me start you off with my day. So, because I have gastric sleeve, and of course I have to take vitamins. I take these because I can't tolerate anything else. My body hates vitamins. I will throw them up if I do not do gummies. I have tried several times. I know that most bariatric doctors vote against them, but mine's like, no. So I do calcium and vitamin D, regular multivitamin, and I double it just because of the gummies. So then I'm getting all the vitamins I need, and then probiotics. Then I take, here, I'll show you this. And by the way, my office is in my closet because my house is small. So there's my clothes too, but that's all my meds. So, I might be here for a little bit. Next, I take hydroxychloroquine every morning. 2 pills. It's 200 milligrams a piece, so I take 400 milligrams of that. I'm trying to look for my next one, which is, not in here. Hold on. Hold the phone 1 second. I will go get it. Okay. Mycophenolate, which is a mild chemo drug. Yeah, chemo drugs, those are fun. I have bruises all over me, just because of the easy bruising from the chemo med. But it helps with my lupus and my RA, keeps that in check. It also helps a little bit with Raynaud's. I think it gets the circulation going. I don't know, maybe that's the hydrochloroquine. I never can tell. I always have doctors ask me, well, what do you think of blah, 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 doing blah, blah, blah? And I'm like, hell if I know. Next, I got pregabalin, which I was taking 75 5 times a day, but now I'm taking, she just changed it to 100 5 times a day today. So I will now be on a new prescription of that. I am on carbamazepine, 200 milligrams twice, 2 pills 3 times a day. So that's, I don't know, I can't even do math right now because I'm so upset. What is that? 800, 9, 10, 11, 12. 1200 milligrams of that. Sorry, I have to count sometimes when I'm frustrated. I can't think. So that's my day. And then I, of course, have arthritis. 650s. I usually take 4 of those in the morning, just to kind of manage with all over pain. Buspirone, which is to level out my moods, just because I'm dealing with a lot, I guess. And my rheumatologist says, well, if you're happy, you feel better. So I guess here's me feeling better. Citalopram, same kind of concept. It's anxiety, depression ordeal, but it's supposed to help you feel better, I guess. And then I have Lamictal, which is supposed to be, I take it twice a day, 25 milligrams, and I didn't go back. I need to go back. Citalopram is 20 milligrams twice a day, and buspirone is kind of PRN. She says as I need, but I only take 2, sometimes 3 a day. The Lamictal, 25 milligram tablet twice a day, and then we get into the bedtime, which I can, I'm taking pregabalin, carbamazepine at that point. My nortriptyline, which used to be a PRN, but I noticed it started helping and it would help me rest and sleep. It's 50 milligrams. At bedtime, hydrocodone, acetaminophen. I take 1.5 of those to 2 of those. Usually like around supper time, I'll take 1, and then around bedtime, I'll take another. Tizanidine, this really knocks me out, so I take 2 of those at bedtime if I need them. That's kind of more like a PRN. I do take omeprazole for my stomach, just because I still do get heartburn, probably from all these meds. I have an albuterol inhaler. That's for the pleurisy that is because of my lupus. So pleurisy is inflammation in the lungs, and then I also get inflammation in my heart, which is costochondritis. So it kind of mimics like having a heart attack, especially when I'm inflamed. You can hear that my voice is getting cracked, which means I am definitely inflamed because my lungs are getting tighter. So I'm going to try and use this, see if I can knock that out real quick. Charlotte's Web. Now I have the oil too, but I'm out of it, and I've been just adding this in I use this salve for my mouth sores, and I get mouth sores in the back from the lupus. I also get the red butterfly rash, I guess, on my face. And then ketamine lozenges, which are once a day. They just kind of take the edge off if it's really burning. And then steroids, which I use as PRN, but they're thinking they're going to have to put me back on them daily because, my body's just fighting me too hard. And the lupus is not under control right now. It's absolutely insane. So I'm probably going to have to change my medication again. And then I am on this mouth sore relief stuff. Now, this is something I thought of, and it's been working so far, but when my mouth inside is burning, like I just ate a hot pepper, like ghost pepper, I don't know. I put this in there, and it kind of chills it out a little bit. So I've been kind of thankful for that. It's like Cankasore. You put on canker sores. It's benzocaine, and it I don't know what it does, but it's been helping a little bit take the edge off of the burning and searing pain. I just started back up the steroids, which are PRN, and I've noticed that has helped too, especially when I'm in crisis. And usually I get in crisis, I guess, so I didn't finish the story. It starts at like 10:30 in the morning, and it starts with, the numbness, the tingling, and then it starts to move through my face throughout the day. By the end of the day, I can't really see out of the right side of my eye. It gets very blurry. It feels like somebody's driving a nail through my head. And then sometimes it gets so bad that it'll go back here in the back of the head and all around, just on the right side, which is absolutely crazy. Craziest feeling. I mean, not fun feeling. Not crazy good. I do have this pain cream, which is baclofen, gabapentin, ketoprofen, and lidocaine, which hasn't been really working, with the hydrocortisone so it doesn't burn my skin. I really don't like putting it on my face because it makes my face all oily, and then I get pimples, and I don't want that. I have been trying this. It's called TheraWorks. You get it at CVS. It's like $18. I don't think it really does much other than kind of cool my face. So, and it kind of helps with the muscle tightness in here, because it feels like, I don't know if anybody's got like, I don't know, muscle, chewing gum all day or something. It gets really tight in here. So yeah, that is pretty much my day every day. It does come and go, and I can get like, I think the longest I've gone is maybe 4 days, 3-4 days, where I didn't have any pain at all, or maybe light numbness, or maybe slight burning, which those days I do as much as I possibly can to get my life together, because I know that I'm going to have to make up for it somewhere. So, yeah. Anyway, I'm going to cut the video short. I didn't want to make this half an hour, but it looks like I have. So, I'm open to suggestions. Anybody has any ideas? We have been talking surgery. the gamma ray rhizotomy, and there's one other. I have had injections, Botox injections. I have had the spinal block or nerve block injections. Those worked for about a week, and then we're just back to square one. So, I don't know. I hope to do a video where I don't look like total shit, but hopefully that will come with time. It's good for you to see, the puffiness on the right side of the cheek where it pains me. It will get bruised in here. It will look like somebody actually did punch me. So if you have any questions, I am open to, I don't know. I'm open to find some answers. I'm happy to answer some questions, I guess. So thanks for tuning in, and hopefully I'll see you later. Thanks. Bye.